Are you experiencing hair loss and wondering whether to go for hair transplantation or PRP? Not able to decide which treatment to take? Then this is the video you should watch till the end. Hello everyone, I am Dr. Shrenik, consultant dermatologist, New Road Skin and Hair Clinic. Today, I'll address the most frequently asked query: does PRP or platelet-rich plasma regrow new hair? The answer is surprisingly no. PRP is a concentrated solution of platelets, which are a great source of growth factors. These growth factors can stimulate the stem cells present in the hair bulge, so it will promote the growth of existing hairs. So one has to have hairs for PRP to work. PRP increases the diameter of the existing hair, strengthens and improves the quality of the hair. So what exactly it does is, it prolongs the anagen or growing phase of the hairs so that they stay in this phase for long periods without getting shed. So when is it PRP recommended? It is suitable for those who have diffuse thinning or who has excessive hair fall and who have telogen effluvium, and in those who have thinning on the crown area. It is known to work better on the crown than on the receding hairline. If your hairs are completely lost with no roots left, then PRP will not restore the receding hairline or the lost hairs. So how to know whether you have still hairs or not? There comes the role of trichoscopy, where we can analyze the hair density, diameter and quality. If you can see hair roots still left, then definitely you can go for PRP. If the miniaturization has progressed to a point of no return, then hair transplantation is the only option to get back the new hair. Also, if the density of the hairs are less than 50% of the normal, then you can safely undergo transplantation without getting damage to the existing hair roots. So to visit our New Roots Hair Clinic for more insights and to decide whether PRP or hair transplantation suits you. Thank you.